Good morning. Yesterday we uploaded and posted some specific aspects of mental health in autism and PTSD. I hope you guys found that informative and hopefully inspiring. It was very inspiring to make that um, over the accumulation of many years of learning and studying and understanding. Um, there's so much more that's needed, and incredible people out there doing the work. This video is part two, really a separate video, but I also wanted to talk about some more of the detailed specifics of mental health in Ehlers-Danlos and connective tissue disorders. One of the things that I hear in usually very private moments of awareness and realization is that individuals with our condition almost wish they had cancer. Not because they wish they were dying, that's nothing to do with it, not because they wish to go through everything that you have to, but because in many ways we are. The biggest difference being that most of the time, what we have will not result in our death. And that's extremely challenging because when you have something that is that invasive in your body with so many components, it's at least a part-time job and often a full-time job to manage, you long for a conclusion. You long for something to resolve. And it stops mattering whether it resolves positively or not, you just want it to resolve. And so there's a kinship there in watching others, and I have even heard this from um, several people who've been through cancer and had firsthand experience comparing the two. And the difference when you have cancer, your medical team is on board. They talk to each other to coordinate your care a lot of the time. You have special advocates to jump in and help you. You have financial resources. Your community all shows up because cancer in our health vocabulary is dangerous, deadly, and deserves everyone's attention. It grabs everyone's attention very quickly, mentally and emotionally, and cancer immediately sets a set of psychological boundaries for the person going through it. People begin to behave differently, almost to the annoyance of the patient. They begin to regulate themselves better. They begin to pay a lot more attention to their words and to how they address you and to the issues that they bring up, and they ultimately have a lot more patience with everything that you're going through. That is what we long for with the connective tissue multisystem spectrum, and we don't get it. Our bodies are going through incredible amounts of pain and effort that are increasingly prolonged, and there is not natural points of resolution much of the time. I'm going to talk a bit more about that because there are ways to create them, to begin to view things differently for yourself as a patient and take some, um, it's a little bit more effort, but to make some other points of conclusion when you know that that's what you need. But for just setting the stage here, there aren't natural points. In autoimmune conditions is very similar. You are, say lupus, for example, rheumatoid arthritis, you're just waiting, you're hoping that the medications will stop the progression of the immune condition without causing you too much damage in the process, but there's no good way out. It's mentally and emotionally right in there with needing to address cancer treatments like chemotherapy, which some of us have experience with in the autoimmune world. It's small doses, but I remember being quite shocked to find that out, like, oh, well, that makes sense, but you're going to give me small doses of chemo to try to stop this disease, and I have to somehow figure out how to be okay with that, and no one's talking to me about it. No one's talking about the fact that the treatment choices I have to make also cause harm to my body. Big mental health challenge that most other types of illnesses don't have to consider. not seriously. They call it medication side effects. But if you're just getting your migraines treated, if you're just having a vaccine for something, if you're just having this or that, it's not the same. You're considering extra fatigue, maybe a few days of nausea, you're maybe cutting back on some certain alcohol intake or diet restrictions because you can't, you want to protect your liver while you're on the medication. Not with us. We are in a whole other level of many, many medications with potentially really nasty side effects, assuming they've even got us on the right ones. And ultimately, even if that's very simple, there isn't coordination and help. It is um, alarmingly common for patients with allergies to medications, which many of us do, to be prescribed something that they shouldn't take, that's dangerous to take, and no one checked or paid attention to the allergy statements on the medical chart. That happens a lot in multiple states. It's not just, hey, this is what's happening here where I live, or this is my little hospital network of experience. I have worked with clients in 8 different states and 3 different countries so far. It happens a lot more than it should. And that's not something, unless you're in a very, very terrible scenario for cancer care, that's not something that happens. People pay more attention. So let's go through mental summary of what are the mental health challenges that come up in this comparison. Lack of resolution, uh, small or large, in the care process. Lack of attentiveness and awareness from other people in our lives, family, nurses, other medical staff, therapists, etc. Um, there is a lack of communication across the board within the medical disciplines, within the support networks and structures that people don't know what to do. Can't relate to the process in extreme ways, and then that burden falls on us. And so that would be my number 4, is that it leaves us with an incredible weight to educate others who may not want to be educated or talk about the real impact that it has on your body. And that's all happening without the life-threatening circumstances. We add in the life-threatening circumstances that some of us can engage in, either from a surgical procedure that we need or advancing progression of things like gastroparesis, or in my case, dealing with the MALS, with the vascular compression and the pain of that untreatable pain and almost ischemic blood flow to my stomach. If no one had fixed that and corrected that, that would have eventually, it was wreaking havoc in my body. And um, there's some very sad stories of things like that going missed and untreated for too long in EDS and people dying. So the more those stories come out, even if they're few and far between, the scarier it is, because every single day we're living, experiencing similar treatment. A doctor dismissing our concerns, blaming this new set of symptoms that they see on this other thing instead of investigating it honestly. It's like we become a time-saving project. How can I just deal with this as quickly as possible? So, oh my gosh, this person can't possibly like living with this much medical effort. Why don't we just get them out the door? Like, well, we don't like living with that either, but quality care would make it easier. We'll take the time. Let's take the time. Let's take an hour in this office to really sort this out so I don't have to come back, so I can feel better, or at least feel stable and know how to manage my issues and my conditions. So education, communication, attentiveness and awareness, and resolution. Those are some very significant mental health concerns and impact concerns. Um, when you have cancer, you're not in charge of those things. You can take some charge of them, but there's people and resources for all of them, not for us. And there's many more of us. And we've been on this journey usually since childhood. Hopefully more mild, but not always, and progressing and progressing and progressing. And so we are looking for education resources that people will acknowledge and listen to and believe. It's why many of us become advocates. And whether that's a professional position or whether that is just something that you undertake because you are helping a friend, a family member, and you become passionate about a subject, advocacy is a fantastic mental health outlet for taking all of this energy and experience you have and putting it to good use. Learn it, do it well. We are representing our community, uh, and other advocates can get bad reputations if you jump out there and don't particularly know your stuff. But the core and the heart of advocacy, sharing what you're going through, giving it life, giving it voice, is very significant. Even if only one person sees you do it, you've inspired that person for at least another day. And that's going to give you a deep sense of satisfaction and joy, um, and affirmation. And then you can remember that that happened to you, and the memory can continue to support and fill holes when you're really struggling. Um, so that's where education can go. You turn it into advocacy. Communication also can be redirected towards advocacy, but there is so much stress and burden on communication, and solving that ourselves is significant. My ideal scenario is when I can help a client who has a very close family member or a friend who is willing to be a caregiver, and then to support both of them. There is help needed for communication. Everything from the brain fog and the stress and anxiety of, oh my gosh, I've got 15 minutes to get something done. That third person in the room, it's a three-way relationship connection. It's a triad that's very, very powerful in persuasion. Um, you can see all sorts of different persuasion techniques that use a third person in the process. 12-step programs. You have to acknowledge a higher power. You have to acknowledge a third person in the relationship. There's positive ways to use this and negative ways, but the fact is that it registers mentally and emotionally in ways that are useful. So bringing in a third person to help ease the burden of communication, and then focus your effort on communication, on awareness and attentiveness, and task accomplishment, resolution, achievements into that one person instead of everybody you meet. Take the pressure off. Everybody you meet does not need to know all of this. It would be nice if they did, maybe, but really not. They'd be freaked out and insecure, and they'd be fine, freaked out, insecure, neurotic, and emotional if everybody knew, because most people don't have the capacity for that. But whenever I can support a caregiver and meet with them and help them and their mental health and help them engage with their partner in the medical sense or relationship sense, however that works, really amazing things happen. And we can often get much faster. And sometimes I have the distinct honor and privilege of being that third person for someone in the room, and seeing the impact and the power of that in presence. Don't underestimate your presence. So that's what we can do with communication. So what about attentiveness? I'm working up to resolutions. What about attentiveness? How can we help people become more attentive to noticing? It is a significant mental health burden to feel and remind yourself of the trauma of people not noticing you. So the first thing you need to do is get yourself into some somatic experiencing, some EMDR, some MEMI. There are some MEMI. There's several modalities. And EMDR is not with vision. I have vision problems. We use, my therapist uses vibrating paddles, one in each hand, and I've heard others that use alternating sound, bilateral stimulation music. You can get almost anywhere, YouTube, Spotify, Amazon. All have bilateral stimulation music. You can do at home. You can tap side to side on your own body. in the moment for dealing with panic and anxiety and stress, but you need to get yourself into something because there is what's called attachment pain. And lack of attentiveness frequently equals attachment pain. Um, and attachment pain is when there was an expectation, a valid expectation of some type of connection that was then neglected or more directly, I don't like using the word abused because of the grander connotations, but abuse does fall into that more severe category of attachment pain. Abusers, chronic abusers, will use attachment pain, the smaller versions of disappointments, to emotionally manipulate and make people dependent on them. So attachment pain can be, especially in neurodivergence, it can be hoping for someone to connect with you on a special interest, and then they dismiss you and don't give you their time. Maybe not even a mean way, but they don't reciprocate the joy or the interest. It can be longing and expecting for a certain outcome, and then that outcome not taking place because of another person. People are important. Attachment pain is the connection to people. And it can be the expectation of attachment or the actual generation of attachment. Both are equally significant. And so when we get all these little things that go missed and unnoticed, like medications not being checked, can lead to a series of unresolved attachment pain. And when attachment pain accumulates, it results in trauma. They're now recognizing some of these under the category of things like CPTSD, because the body gets wired to expect and anticipate a very particular kind of pain or rejection, and then begin to respond with increasing levels of fight, flight, freeze. And that falls into the PTSD category, which we're trying to advocate very strongly for there to be more of a spectrum understanding of that instead of the all or nothing version that gets many of us dismissed. You can't possibly have PT. It's like, oh yeah, yes, because this is how psychology works, actually. It's the symptom, it's the result of things like repeated attachment pain, because it's pain, it's repeated pain that we cannot avoid. And that's important. We cannot control all of the nurses to get this right. We can't control all the doctors to get these things right. Even if we had the knowledge and expertise to be able to do it ourselves, we would not be in control. And so these frequent, repeated pieces, these pains, come over and over again without our control, but our condition demands that whether we want to or not, we have to continue to show up in that same space over and over again, expecting a different result. Guys, that is the breeding ground for PTSD. I needed to do that. Thank you. That was epic. This one's tricky. You need to get yourself into some kind of regular recovery. Your brain and your body were not meant to bear that load. And the anxiety that is going to build up in your body trying to carry that load is going to lead to doctors and nurses thinking the thing you fear the most, which is that you are unstable and that you are not cognizant or intelligent. Your physical expressions in those moments, the way that your tone and voice will change, they will start to signal the very thing that you want people to not see. I don't mean not see as in hide. I mean that we're afraid of being dismissed for a mental health reason. This will do that to you. And when you don't actually have therapy and healing to recover, then you end up with quite a heavy amount of masking. And I promise it's not as effective as you think it is, because you're dealing with people who are medically trained, who did have a few classes in psychology and behavior among patients, and you're not fooling anyone. some of you more advanced individuals in the masking department, maybe we might be able to get it across, but it's a minefield of communication hurdles to get through. So that's your first step on mental health. You have to deal with those repeated attachment pains. And you can do that by continuing in some kind of therapeutic process. And you can do that by using more tools in the moment of your anxiety and your stress, like I mentioned, tapping, breathing techniques, Buteyko breathing, which you can get on YouTube, helps with asthma, breathing things too. You can calming, stilling things, compression. Be comfortable. Show up to appointments comfortable. Gosh, if you think your anxiety is going to communicate louder, show up in a hoodie with your favorite mug. Wear your sunglasses the whole time. You're not making it better or more effective because you don't make your body comfortable. Go into those appointments with, if you can't have a third person, go in with at least with things that you feel you need. I always have my beads with me. There's backup pieces to support your mental health in the moment. In the moment. And you can do that for yourself, and it will not be too exhausting because it will become a habit that's a really healthy one for life that your body will enjoy, and it will help you. So that's we could talk about that's a whole series right there. So let's look at the last one, resolutions. I said at the very beginning and started with the biggest one that cancer has a resolution. There's an end. Many, many times in a chronic condition like this, we do want to be done. It's not mean at all that we are contemplating suicide or acting on it. It does not mean we're contemplating self-harm. It's a reflection of the fact that our bodies have been in pain and they are causing their pain, and that normal things like walking cause excruciating pain. And then treatments we have to choose cause pain. And I'm using pain in the very simplest breakdown as a technical psychological term of repeated exposure. We could describe it in all sorts of different ways, but it boils down to pain and pain responses. So anytime you have pain in the body, you have to deal with pain response. And in my other video, I talked about threat and threat response and those differences in PTSD and autism. And you may find that very, very effective and helpful. In addition to this video, even if you are not neurodivergent, there are things that you can learn about to cope with threat and threat response in healthy ways.